This is Apple Valley News Now at 6 on your side.
Thank you so much for joining us here on this Thursday. I'm Wendy Redmond.
Hi everybody, I'm Austin Reed. It is February the 5th.
Well, a new program in Richland could make it easier for people in the Tri-Cities to get mental health care without leaving their primary care doctor.
Complex Care Center is now offering a collaborative approach that brings psychiatry into the primary care setting. And in a story you'll only see here, it is already changing lives.
So it just kind of helps us get more access and help those people.
Finding psychiatric care in the Tri-Cities has been a challenge for many patients, often forcing them to wait months, travel out of town, or go without care altogether.
To say, hey, we have a patient that is being treated, and what would that next step be?
Now, a new program at Complex Care Center off Stevens Drive in Richland is working to change that.
So this is really exciting. This is the first time that Medicare and some of the commercial insurances are starting psychiatry within a primary care setting.
The program is called Psychiatric Collaborative Care. It launched late last month and allows primary care providers to manage mental health treatment while working closely with a board-certified psychiatrist.
This bridges that gap.
Doctors meet weekly with a psychiatrist and care team to review medications and treatment plans, keeping everything under one roof. For patients, that access can be life-changing.
I couldn't have dreamed for a better situation than this to have happened for people like me.
Pamela Haywood says she has lived with depression and anxiety for years and struggled to find psychiatric care covered by insurance.
You don't get to have a chance with insurances sometimes, like with mine. You can't find a psychiatrist. You can't find anybody to talk to.
She says medications and consistent care have already made a dramatic difference. Her boyfriend agrees.
It's been hard. There's days that I was like pulling my hair and going, what do I do? Gee, she won't even leave the room.
Before finding the program, she says the lack of access left her in a very dark place. What was life like before you had Dr. Algier?
I, many times, didn't want to get out of bed. I didn't care what was going on in the outside world. There were days it was dark enough. I didn't care if I was here.
Dr. Algier says stories like that are exactly why the program exists.
There is a lot of overlap between the primary care and psychiatry already. This added piece adds the board-certified psychiatrist MD that we work with, which is a critical piece, right?
And it's hard to refer. It's hard to find people to kind of say, hey, we really need to, this patient to be seen.
I think if they can get in here and talk to the doctors, they'll see it. They'll say, well, this is night and day.
Pretty much done a 180 since I've found Dr. Algier. Yeah, he's a blessing.
Complex Care says the program is open now and they have slots available. We will have a link to their website and contact information directly after this newscast on our website, applevalleynewsnow.com.